Hi, everyone, and welcome to our monthly SIO Spotlight series. Get ready to meet the amazing members that make our society shine. Each month, we will highlight a different SIO member, highlighting their unique story, what celebrating their accomplishments, and learning about what really drove them to a career in integrative oncology. To begin, I am Tabarak Qassim. I am a resident doctor at Cambridge University Hospital in the UK, as well as the co-chair of the Education Special Interest Group. So today we've got with us Dr. Alissa Huston. Could you please introduce yourself?
Sure. So I'm Dr. Alissa Huston, and I am a medical oncologist. I subspecialize in breast cancer care. And the other part of what I do is I am an integrative oncologist. I am co-director of the Pluta Integrative Oncology and Wellness Center, and that's part of the University of Rochester in Rochester, New York. And what's wonderful is I get to merge my medical oncology training and my integrative oncology training together as I see patients.
Beautiful. So, Dr. Houston, we'd like to know about what really, at the very early of your career, what really drove you to a career in integrative oncology, and how did that start? Who really inspired you?
So, a lot of this started originally with my patients. They would come in their follow-up visits and ask questions about, I read about, this information with exercise or mindfulness. And they started many, many years ago bringing questions. And that drove my interest to want to know more and dig deeper and understand where research and evidence was related to integrative oncology. I also have an incredible co-medical director who had done training previously in integrative medicine. And as we began conversations, she's a radiation oncologist that also happens to care for breast cancer patients. So we work very closely together. And as we began conversations, we kind of understood and wanted to really provide and create a place and learn more so we could provide those services to our patients. I think the other thing I would say is that we had some of those growing resources in our center. We had a massage therapist and a really wonderful nutritionist, but we said there's more out there and there's more that we can do to be able to bring to our patients. And this paralleled along as we've seen such growth in the research surrounding integrative modalities and how they can support our patients. So I think it was really a combination of different individuals also being driven as always by the patients that we care for. And then I guess the last piece I would say is that SIO also played a really big role. Going to my first SIO meeting really inspired me and began that connect point with specific mentors that then I've been able to continue to work with.
Wow. And when you say you were seeing the patients, was that during
Yeah.
residency or fellowship or as an
So that
attending?
was, yeah. So really, as an attending during fellowship, of course, when my fellowship training, we were able to focus in on certain disease groups. That was just the way that the fellowship program I was in was run. But then it was really as I was an attending that patients would come and bring questions, and I always encourage them to bring questions and if they have something or they've read something. And so different patients over time would bring, I read this or I saw this, or can you talk more about this? And I think that's been a really wonderful piece of how that has, really from different positions and different places has really driven that interest and that passion to really learn more and to be able to then bring that back to my patients.
Lovely. All right. So, could you talk to us about a particular story that really stands out for you where you've helped this patient or some person using integrative
Mhm.
oncology therapies, what exactly you've used and what effect it's had on them?
So I have maybe two ways of answering this. The first is thinking about back a number of years ago, we had just started some of our group acupuncture classes. So we recognized that acupuncture can be so beneficial for patients clearly on an individual basis. And this is supported by, of course, the SIO ASCO guidelines for joint arthralgias, particularly also neuropathy. Those are kind of the two big areas right now. that we have group programming in, and we wanted to be able to offer more to our patients. And so we piloted a few different group programs focused on those symptom areas. And one of our patients who had really been struggling for quite a while with persistent neuropathy symptoms reported just such a significant improvement. And this made such a difference in her quality of life, her function, and it was pretty remarkable, her personal story. And granted, patients have different responses at different places, right, along the spectrum in that area, and in terms of their response. But this really, really impacted what she had been navigating for so many years. And that was really a wonderful thing to see her then share that, talk about that with others. It was highlighted kind of locally. And that was really a wonderful thing to see just because of the difference that it made.
Yeah.
And I think the other piece is I often also hear when I see patients, and I'm struck by this across the board, is many times we have patients that I'll see early on in their treatment course, but sometimes patients get referred to me after they're towards the end of their treatment and moving maybe into long-term follow-up or survivorship, continuation of their survivorship care. And they say, oh, I wish I had kind of heard about some of these resources earlier. And so it's being able to, that always strikes me. And okay, how can we provide things earlier? How can we really expand that education, right? I think that's so important in the work that's being done in the education space to help educate our patients on where these resources are and how we're able to offer them. And it just always strikes me that here we have these resources and how do we use them earlier? So, and then they come back and tell me how much of an impact, those different resources have made.
Wow. And I know it varies person to person, but for this
Yeah,
specific patient, like at
yeah.
how many acupuncture sessions did she see a difference?
So our group program runs over 6 weeks, and patients are receiving 2 acupuncture sessions a week. So it was about 12 weeks. So is where she had what her participation, she participated in all the classes. So it was about a 6 week course of acupuncture that she received, but twice weekly sessions.
Perfect. Beautiful.
Yeah.
So, yes, so going back to your career, you've
Hmm.
already mentioned who really influenced your integrative oncology work,
Yeah.
but is there any specific mentor that you'd like to highlight, a quote?
I would. So as I mentioned, going to my first SIO meeting just really helped solidify what was going on at a national, international level, where the evidence and research was, and kind of what I saw and what I was hopeful, right, in terms of my own career path and what I wanted to bring back to the where I practice and see patients. And with that, I would say there's two individuals at SIO that I will name. One is Susie Zick and the IO Scholars Program. That was really instrumental. I learned about IO Scholars at my first SIO meeting. I myself, and at the time, my program manager applied. And that really was foundational in creating and providing some of those additional tools as we were getting ready to open our integrative oncology program, just to really provide some of that, those foundational pieces that I think were really important. And Susie has been a continued mentor. I just graduated with a fellowship in integrative medicine from the University of Rochester. So I've continued to work with her and her programs over time. And so she's just been a wonderful mentor in that space. The other person in SIO I would name is Judith Lacey, who's also been just a really incredible support. And I know as part of the clinical practice committee when I first joined. And so I'd say both of those individuals have just provided, great mentorship and guidance and support over time as I've grown my program locally, expanded my education, and developed along my own career path.
Wow. And over how many years has that been?
Oh, that's been since 2016, 17 was when I
Oh,
first
wow.
started, and then I participated in IO Scholars. That was actually 2019, 2020. Our program had opened just a few years, but we were just opening it around that time. And so everything kind of aligned together during that time frame.
Beautiful. And last but not, I mean, last question, last and final question. Where do you see the IO field going? And yeah, honestly, where do you see it going? And what excites you the most about this?
Yeah, I think what excites me the most and what I have, what I am hopeful to see is the continued integration at all levels of integrative modalities for patient care. As we see the expansive growth of guidelines that have come out when we think about pain, anxiety and depression, fatigue, the use of those guidelines where we can tell our patients we have this wonderful and strong evidence that we can use. And I talk all the time about we can pull it right, integrate it right in with the patient's standard care. I mean, that's the definition of integrative oncology, which again, when I speak about this with patients, I reference back to all the time, because I think it really helps patients feel like there are these other supportive modalities that can be used. And what I am hopeful to keep seeing is that this just becomes part of a patient's care plan so that patients coming in to the Cancer Institute that I work at, when they're coming in to talk about their bone marrow transplant or their, lung cancer chemotherapy or breast cancer chemotherapy, it's here is your plan, and we're going to connect you in with the resources in our Integrative Oncology Center to really help create a prospective plan to help patients as they're going through treatment. And I think we'll continue to see that with the expansive growth of guidelines and as integrative resources are becoming part, I think, more of the conversation and how we approach patient care. So, yes, that's what I'm continually hopeful for. And what I've seen even over the past several years, and just how my colleagues are referring patients in for their consultations, and patients are really engaging in services.
Yeah.
And it's exciting to think about that this would be as standard as other interventions.
Yeah, and I'm smiling because every interview I've had so far, the
Yeah.
interview you would answer the exact same question. We want this to be the standardized way of care
We
as opposed
do, but
to like something additional.
right, but I think it makes so much sense, right?
Yeah.
We have things, mindfulness, acupuncture, yoga, just so many different integrative modalities, nutrition, the incredible, resources with nutritional interventions and exercise. We see studies now showing, the benefits of exercise in improving colon cancer outcomes. I mean, so I think we're really starting to see this across the board. And I'm just excited for that. And how SIO has played a huge part in that and will continue to on a large scale, right? On a national, international level in terms of moving that forward through the use of guidelines and promoting the strong evidence and doing the research that's needed to really show the benefit of integrative interventions for our patients.
I agree. I look forward to such a future as well.
Yes, yes,
Dr.
absolutely.
Thank you so much for your time today. I'm really grateful for you waking up in the AM and really having
Oh, of course.
and you agreeing to have this on a weekend. So I'm really thankful for that.
Oh, absolutely.
To our viewers,
Yeah,
thank you
thank you.
so much. We hope you've enjoyed this month's feature on integrative oncology with Dr. Houston. We look forward to meeting you on the next one, interviewing Dr. Santoshi Narayanan from Anderson Cancer Center. Thank you, everyone. Thank you, Dr. Houston.
Thank you so much again, Tabarak. This has been wonderful. I appreciate your time this morning.
Thank you.